space where diagnostic and therapeutic support elevates the standard of care. I invite Dr. Geethanjali to speak on the topic Secondary Healthcare, the Cruise.
Sai Ram to everyone. I think it is going to be little repetition because we have to take name now and then only our faith increases. I thank Swami for giving me this opportunity to talk on his humongous work being undertaken. Let me start by telling you a story. There was a village. There were two friends, Gopal and Krishna. Gopal was a rich businessman. Krishna was a poor farmer. Both were ardent devotees of Pandharinath Pandharpur. Gopal was not able to go to Pandharpur because of his work. So what he did, he gave 100 rupees to Krishna and said, whenever you go to Pandharpur, please give this to Swami. Now Krishna used to go walking to Pandharpur in Vari. He started. And then while going outskirts of a village, he saw an old man and he felt compassionate. He gave 5 rupees from Gopal's money to the old man to have food. The old man was very happy and he blessed Krishna. Furthermore, he saw a poor mother with her sick child sitting, don't know what to do. He felt again his heart melted. He again gave the money from Gopal's money, thinking, Swami, I'm not using for myself, I'm giving to the needy. And so on and so forth. By the time he reached uh, Pandharpur, 2 rupees were remaining. He offered it to Swami, prayed for Gopal, came back. After coming back, Gopal asked, did you give the money? He said, yes, I gave. That night, Pandharinath came in Gopal's dream and he said, I received your 98 rupees. Where are the 2 rupees? Gopal was so angry. I gave my friend 100 rupees and he's not given to Swami. So morning he went to Krishna. Why didn't you give the 2 rupees remaining? What did you do with it? Then Krishna narrated the whole story. And he told to Gopal that service to human is service to God. Isn't it our motto of our Swami? So it was, as you know, it is going to be a repetition, but because of Swami's mother, he started the healthcare mission and hospital in Puttaparthi first in 1954. After that, in August 1976, he started a hospital in General Hospital in Whitefield, just 4 or 5 kilometers from Vrindavan Ashram. It was mainly for catering to the pregnant mothers and children. The Whitefield Hospital was started as a small OPD, and I have not been, I have worked in the General Hospital. It's like a family working together. Then also it was started as a small OPD with maybe few beds. And as the villagers started, the hospital started, getting popular, the infrastructure started increasing. It was started with one doctor, then came in early 80s, Dr. Savitri, who whole and soul gave to Swami. With Swami's blessings, she did seva till the end of her life. The General Hospital slowly started adding than mother and care, other OPDs like pediatrics, medicine, and the surgical branches started, orthopedics, ENT, general surgery, urology. So much devotion Swami inculcated in his devotees that they were ready to give everything to Swami in the form of money, in the form of devotion, in the form of instruments, and in the form of time, which is most important. These doctors used to work in their private setup in the mornings and come in the afternoon and then under Swami's blessings do all the surgical work and the OPD. This was the hospital earlier. Dolly's sister, one Parsi lady, nurse, who left everything and came under Swami, used to tell how Swami used to come so often to General Hospital and he used to talk to everyone. He was very close to each and every person. Blessed are the doctors who Swami used to see during operation through a window in the operation theatre. Each and every person in the hospital was taken by Swami. Each bed, each ward, each instrument was blessed by Swami. Whenever Swami used to come to Vrindavan Ashram, Dr. Savitri used to call him on a smallest part to inaugurate, and Swami used to come happily to inaugurate. Then came Dr. Bal Subramaniam. Swami appointed him as a medical superintendent or director. And during his tenure, with Swami's blessing, the hospital increased to a small little hospital, full-fledged hospital with its own small lab, physiotherapy unit, radiology unit, OPDs, and the doctors, not only from Bangalore, but even from Singapore, from UK, from USA, used to come regularly. Doctors visiting usually used to give 1 day of their week for Swami. This pattern, even now, continues in the multi-speciality unit in Whitefield, SHWIMS Whitefield, where doctor come regularly on the day they have given, Monday or Wednesday or Friday or Saturday. Sometimes we don't have a case, so we don't call them. So their call comes to us. Why are you not calling us? Our day it is. Why didn't you keep a case for us? That much dedication they have, almost 30 to 35 years today. Swami has provided us with advanced equipments, the state-of-art equipments. He has given us the best anesthesia workstation, the best microscope, laparoscopic tower, arthroscope, endoscope. We are being blessed by Swami for these equipments are so good that the doctors visiting from outside say, I also don't have this laparoscopic tower where I work. Let us see at the statistics. Statistics doesn't show much change, maybe little bit. The operatives are also, some departments closed, but new departments have come on. Point is, now the patients are also demanding. Patients earlier were different than what patients we see now. They have shopped around. They have multiple comorbidities. They demand more. They can't wait. They are so angry when we tell that your date is after 3 months. They fight with the doctors that saying, why you're giving date to him, not giving date to me. But our doctors, sevadals, nurses, they make them calm down and their faith increases in Swami. It is so heartening to see sometimes a patient traveling from 1500 kilometers just for a sebaceous cyst removal or just for a perianal abscess because some neighbor told him that you go to Swami's hospital. It is very overwhelming when some patients are treated and they are so happy. I will tell you one story. One patient was operated. He went to Bengal. He was so happy. He came back with Mishti Doi. He traveled in third class or unreserved compartment. Took 3 days to reach. By the time he came here, the Mishti Doi had gone bad. But we felt the love he felt for Swami. There was a thyroid patient who was relieved of her symptoms and a big thyroid being operated. Her husband being a weaver, she made him weave saris and she got an offer to Swami. One scoliosis patient we were operating, 15-year Muslim boy from Baradwan district. Before induction, I just asked him, what do you want to become? He said, I want to become a doctor like you and serve in Swami's institute. I said, it's very difficult, okay? You have to study hard. He said, no problem. If I get better, I will pakka do it. This fellow was corrected his scoliosis. He went back to Baradwan district. He gave NEET and he's now pursuing medicine in Calcutta Medical College. What do we learn from all this? That karmanne ravadika raste ma phaleshu kadachina. We should just keep on doing our work. without thinking what I'm going to get back from it. I think that is what I learned from working in this hospital. And I hope Swami blesses us all. Sai Ram to you all.
Thank you, Dr. Geethanjali, for sharing with us such beautiful, heartwarming stories of patience, love, gratitude, and reciprocation, and for showing how the mission supports patients through steady, compassionate cruising towards healing. We now step